Hey, welcome back to Know Thy Health. Today we want to talk to you about healthcare sharing ministries, the good and the beautiful of healthcare sharing, and as well as some of the gotchas and some of the things you should be aware of as you look into healthcare sharing programs and their options and their alternatives to health insurance. The first thing we're going to talk about today is the regulated versus like non-regulated approach of healthcare sharing. While they are you know legal entities, they're not regulated insurance companies, as we know. And so we want to talk a little bit about that. So I want to hand it over to our actuary and CEO, the risk whisperer, Daniel Cruz, to give us an insight on that.
Thanks, Cameron. Yeah, this is a really important topic that often gets misunderstood. And I think part of the problem when you think about health sharing, healthcare, health insurance is really for most Americans, it's a opaque, non-transparent, complicated thing to begin with, even though 93% of Americans have insurance. Many Americans don't even understand how their own health insurance or health plan works. And so the first thing is to dispel some of the language differences out of the gates, which is, health sharing is ultimately risk sharing. You are contributing to a health sharing ministry organization, a nonprofit organization that pools risk. They don't call it a premium, but you pay a monthly amount that functions as a premium with the purpose that ultimately, if you have some large catastrophic medical incident, there's money there to then pay those medical bills. So health sharing equals risk sharing, and risk sharing is essentially health insurance. So these are really just different terms describing the same exact thing. And really the big difference between, say, a health share and a health insurance company is that, again, like you said, Cameron, teeing this up, one is regulated, that's the health insurance company, and one is not regulated, which is the health sharing ministry plan. I think what as I've thought about this, how to help people kind of understand this better is kind of bring an analogy into play for another highly regulated industry, which is the airline industry, which I think we can understand a little bit more of why there's regulations in place there. So to start off, like you could think about like, um, you know, in an imaginary world, if there was a situation where the federal government said, for a Christian version of an airline company, we're just not going to regulate this nonprofit Christian airline company as long as they call it something different than an airplane. You can call it like a Skyrider or whatever you want to call it. But the point is that whether or not you call it an airplane, a Skyrider, or whatever it is, at the end of the day, like an airplane that has to go through the air is subject to the same laws of gravitation, just the way when we talk about health shares and health insurance, it's subject to the same laws of statistics that you need to come into play, that, there's money there when these catastrophic, low probability situations happen, like heart attack, stroke, et cetera, right? So we're going to get into that in a second. But I think the first thing that I want to start off is why the health shares came into prominence, why they're a good thing, why they've actually served. Now it's close to 2 million Americans and really exploded after Obamacare, which is, let's start with why it's good to not be a regulated entity. So one of the biggest problems with regulation is that it can balloon the cost of a health insurance product. And we all know what happened with Obamacare. It came in around 2014, a new individual market product, and the regulations that were put in place really created winners and losers by ballooning the cost for a certain segment of the population. So the biggest thing is that it created a guaranteed issue environment, meaning like if you have a current condition, the insurance companies can't deny your coverage. So you could have active cancer treatment. You could, have just had a heart attack, and insurance companies have to take you. So it's made the risk pool in the insurance environment, the Obamacare environment, very unhealthy, meaning the costs are very high. Now, with regulations, whenever there's regulations, they create essentially a path for winners or people that are helped by it, and path for people that are essentially hurt by it. So the winners in Obamacare were low-income people got subsidies to take away that high cost. And then, of course, those that have current conditions like cancer, or they just had a heart attack or something, like, obviously they're a winner because they can't be denied, right? But there was a whole segment of the population that didn't receive subsidies and are healthy. And these people had to bear the burden of that ballooned cost of a regulated environment, right? And so that's really the beauty of where the health shares were able to help out and why they catapulted to success after Obamacare was that they were allowed to, number one, exclude members with pre-existing conditions. Now, that's a some would say that's a bad thing, but the reality is if you have a pre-existing condition, the federal government created a great avenue for you to get care. So it's a good thing in the sense that it allowed for an opportunity to create a healthier risk pool that people who are unsubsidized and healthy can save thousands and thousands and thousands of dollars by joining these health share ministry programs. So I want to start off by saying like there are good aspects to not being regulated, and cost is one of the biggest things. Now, what's not well understood and what's really important if you're on a health share or if you're thinking about a health share is to understand some of the downsides of not being regulated. So again, I'm going to draw on this airplane analogy because I think it's helpful, and I'm going to just talk about like two reasons why regulation is important for consumers and why it could be risky or dangerous to say go on a health share that's not regulated. So reason number one is that in the health insurance industry, you essentially have pilots, trained, certified, professional pilots flying the plane. In the health insurance environment, these are called actuaries. Now, actuaries are trained for 5 to 10 years to develop premium rates, the amount that you pay monthly, at a right statistical level that's going to make sure that that money is going to be able to cover these catastrophic events, right? So you don't want to create premium rates that are too high, or you especially don't want to create them that are too low, so that like when people need the money, the insurance company doesn't have it, right? And so it's like a pilot that has done thousands and thousands of hours of flight training to make sure that they are piloting the plane correctly. Now, health shares do not have to use actuaries. Now they can use actuaries, right? But they're not required to use. So when you're going on a health share and you're paying a monthly premium and you're like, "Hey, it's so cheap. This is great." Well, you should pause and say, maybe it's too cheap. Maybe they didn't have a certified actuary think about this properly, and actually they haven't funded this well, and when you need your bills paid, they haven't collected enough to actually pay it, and you're going to be left in a problem, right? So that's number one. Number two is that when we talk about developing a premium rate, you're talking about like on average what's the monthly amount you need to collect. Well, if you draw from your wonderfully exciting statistical class from high school, there's something called a normal distribution, where in reality the actual costs are going to be either too high, too low. It could be really high, could be really low. You don't really know, right? And so in order to combat this, regulations in the health insurance industry requires insurers to have a certain amount of capital reserves or cash available, so that if their actuaries got it wrong, they still have money on the side to make sure those bills are paid, right? And so in the airplane analogy, I like to think of this as like when you go on a commercial jet, you know that they have two functioning engines, and they actually have even a backup generator in case both of those engines go out to help them make sure they land the plane. So with the pilots, with all the backup engines, it is extremely, extremely rare for a plane to crash. Not that it can't, but it's like very, very rare for this to happen because of those rules and regulations. Now, the health shares, once again, they can have the money, they can have additional reserves and function just like a health insurance company. But the thing is, you don't know. So if you go on that airplane, you don't know if you're taking off with one functioning engine, two functioning engines. Do they have a backup generator? Who's flying the plane? You just don't know these things. It's really at the discretion of the health share whether or not they actually put these safeguards in place. So there are goods to regulations, but to really understand some of the problems, it's helpful to kind of think about the risk that is involved. And really the risk is that you just don't know if they're doing this properly. And again, what's the downside if an airplane crashed? We all know. The people die on the plane. It's catastrophic. It's terrible, right? What's the problem if your health share doesn't have the money to pay the bills? It's catastrophic. If you have cancer, if you have heart attack, if you're sitting on $200,000, $500,000 bill, it's a financial wipeout of your family, right? So it's the reason why regulations exist in both of these industries is because the downside catastrophes are very, very large.
I mean, and I know health shares well, and like we've said before, it's not a big deal till you're bankrupt, right? I mean, I think that's the risk that that a lot of the health shares are that the members are taking is it's not a big deal if you don't get sick. It's not a big deal if you don't get cancer, but it's a massive deal for your family when you're bankrupt.
Yeah, I would just say on the regulation point, I think, most of these healthcare sharing ministries try to take like this whole biblical approach of like Acts 2, right? Where these Christians are I say these Christians, but Christians are sharing resources, right? And bearing each other's burdens. So and also giving the church or the ministry, right, the autonomy to take care of the sick, not the government. And there's this idea, right, that the regulation or too much oversight is kind of an overstep in the state's like biblical role. And so I think that's like the argument most of the sharing ministries would take is that that the deregulation gives them the freedom and the liberty, right, to like have the guidelines that they want to have that align with the values of their community without having the burden of regulatory oversight. And then I think the second point is just on the cost, right? Like I think you made the point that if you're like, oh, this is really cheap or this premium is really low, like maybe you should pump the brakes a little bit and ask, like, why is it so low? But the alternative to that is like, why is the insurance premium higher? Like, whose pocket's getting padded, right? And so, the healthcare sharing ministry is, if run correctly, that's the key, right? But if run correctly, these executives and these employees that work there are doing this out of a ministry capacity and like are probably making a lot less money than people are making at publicly traded or just large insurance corporations where profits are a motivator. And so they can keep costs low if they keep their overhead low and their margins to a minimum, right? So, that's something to consider or think about if you're looking at healthcare sharing.
Yeah. Yeah, but just always putting into context, right? So, like, if they have a little bit less administrative costs than insurance companies, that's not the bulk of what the cost is. 80% of the costs are going to be medical. So, even if they're 10% better on 20% of the cost, that's only saving you 2%. And the salaries of people is really minimal impact. The biggest impact is 80%, which is the medical cost, which that's where the pre-existing conditions come into play. They can cut that 80% in half, right? So when you cut 80% in half, that's 40%. Right. So just like I think there's a lot of times that they want to lean into things like the Acts chapter 2, these type of things, but like it's irrelevant, right? Like at the end of the day, the apostles weren't sharing in $1 million NICU baby premature, like a premature NICU baby having to have the full resources of our modern society that cost $1 million to keep that baby alive. They weren't paying for that. And so at the end of the day, this is why I think the airplane thing is important, is that you need your airplane to go from point A to point B. That's what it is. So you want it to function in the right way. You need your insurance or health share to do the same exact thing, which is like have the right money available so that you get your bills paid. And sometimes some of these things can get a little bit confusing, but it's just helpful to kind of bring it back to that.
The Acts 2 call out's it's interesting for a couple of reasons. And I think one thing that I'm hearing said on this recording is I don't think it's a supplement. It's certainly not meant to be a replacement for something like an insurance product. Whereas Daniel, you just mentioned the apostles weren't sharing in $1 million NICU baby claims, but it also doesn't mean that like it's no longer relevant and we're not called to bear each other's burdens, right? There should be opportunities, and we should be looking for those opportunities where it's appropriate to step in and help each other out. And there's an element of solidarity that I think has been lost in our modern society, and we've allowed some of these modern institutions to supplant that where we maybe shouldn't have. And we need to be a little bit more active in seeking those opportunities out to help each other, particularly within our own family and our neighborhood, right? We've got people down the street from us and family members who are suffering. And rather than just saying they're insured, their insurance will take care of their claims, like maybe it's just like visiting them more often. And like, sure, they're like, I'm not going to be responsible for their $1 million, cancer treatment, but I can still sacrifice some of my day and share in that call that we all have as Christians to pool our resources and be with each other through suffering.
Yeah, well, I think the next piece we want to get to is just like the flexibility of coverage. Healthcare sharing ministries will often and a lot of good and creative work has been done in the healthcare sharing ministry space to have like very flexible program offerings that may be more innovative in some regards, or seem to be more innovative in some regards than healthcare or health insurance models. So Alex, you've got like a lot of, knowledge here and a lot of experience having had worked in the sharing space. So just curious, like how the health shares, um, you know, take this stance of having very flexible coverage, and like what are some of the things to look out for there?
Yeah, I mean, and I mean, flexibility is a great word. I think it could be very good, and as we'll discuss through, it can be really difficult on a patient, you know. And I think health sharing, when it initially kind of hit the space, it was this unknown entity, right? And it really put a lot of the onus on the member to do a lot of the work. And as it evolved and grew, there are a couple of healthcare sharings that partner with PPOs. There are a few out there that partner, or they all of it is on the member, right? Like you'll hear terms like you can go wherever you'd like to go. And that's I mean, what an amazing opportunity, right? You as a healthcare sharing member as long as you're willing to do the work, and you can get the price right, or even if the price isn't right, you can go get the care that you want. And then obviously you've got to wait for the healthcare sharing group and the facilitation of the funds and all of that to pay your bills on the back end. But there really is a ton of flexibility. I think if I could kind of say how that's good and bad, is flexibility can help the member, but then in the same token, the flexibility can also come back and benefit the healthcare sharing entity. And for an example of that would be, as you'll never know how much money's there, right? I think going back to Daniel's analogy with the plane, I mean, we don't know if there's one engine or two engines. There might be five engines. They may have so much cash, they don't know what to do with all of it, right? We'll never know that. And so if a cash position is good, the healthcare sharing, they may absolutely, this really expensive treatment, they don't have to operate by the same utilization management standards, right? So they can skip steps in the care process and just get you to exactly what you need, and say, sure, this really expensive treatment, it's experimental, we absolutely are going to pay for that, right? So that's where it would be really good in benefiting a patient. But at the same token, those flexibility pieces can change really quickly. And those would look like guideline changes. So, oftentimes kind of discussing healthcare sharing, the program you have may not be the program you signed up for. And as medical spend has just increased and the cost of healthcare has become so expensive, you're starting to see things. I know a big one out there. I won't say the name of a healthcare sharing ministry, a really big one. They went through a process and they put a maternity cap in, right? They said, hey, our cash position is getting tight. So we are going to move to put a maternity cap on and say, we will not pay over this amount, right? Which, we don't, healthcare sharing, because it's a non-regulated entity, doesn't go get reinsurance, right? They don't have those protections that a standardized health insurance company can go get. And so, here at Presidio, we're going to have reinsurance, right? So there's not going to be a bill that we're going to run into that onus that is going to be put on the member to take care of. And so I think that's not the gotchas, because like we'd say, like it's good when things are good, but they're just pieces that the members really need to be aware of, right? Guidelines can change at any time. They can be, either member voted, or it might be just the board of directors. They may be a small group of people that can change them. You could see sharing increases mid-year. I think that's one thing. You always look at your sharing ministry. If you're getting increases in June, July, after you've signed up for a price, maybe at the beginning of the year, kind of a red flag, right? So why are we all of a sudden getting, an increase mid-year? And then I think that the changes in the programs, right? I think you need to, so terms like excessive charges, again, a loose term that's used in the healthcare sharing space, but extremely impactful to you as the member. Who defines what an excessive charge is, right? So healthcare sharing, we're going to pay for everything but excessive charges. We're going to pay for everything except if it exceeds this percentage of Medicare, right? Which is a standardized kind of pricing system in our space. And so flexibility, again, it could be great. In some of these really small healthcare sharing ministries, they maybe have a small patient segment in a specific area. They can really serve that group of people really well, right? They may have an individual contract with one hospital or one provider group. And so, yeah, it can benefit. But I think there's some real red flags there in terms of how they can change the rules midstream and how that flexibility can come back and benefit the sharing ministry in pretty dramatic ways.
Yeah, but I mean, the whole network piece is interesting because in one hand, if you're a healthcare sharing ministry or just a proactive consumer, like if you can negotiate cash pay discounts on your own and you're interested in doing so, like you have the opportunity to like save money there, which I think is like a good thing for the consumer. Healthcare sharing ministries get a bad rap at times from providers because like they don't want to work with healthcare sharing ministries, either because they don't like their billing process or maybe they have a history of not getting paid on time. And so you walk into that office and for whatever reason, the provider's like, we don't take XYZ sharing ministry. But I think for the sharing community, like maybe that's a bad thing, but like maybe it's also a good thing, right? Like if that provider doesn't want to work with those people, then why should they want to go see them anyway?
Yeah, but if you live in a small town in Idaho or you live in a small town outside way in West Texas somewhere, that provider may be the only option you have, right? And so you have to have that provider work with you. And Cameron, it's obviously I have just navigated this space for a long time and far from an expert, but chipping my way there, right? The cash pay thing always makes me laugh because I would anyone listen to this podcast, I'd say, okay, if it's that easy, tell me how much a total hip replacement should cost. Tell me how much an MRI should cost. Tell me how much, don't Google it, but go tell me how much, specific medical events could cost. And then once you figure out, most people can't, right? So they're like, oh, cash pay is easy. You just go in there and you ask for it. And then the second side of that is, okay, so once you do know the cost, ask yourself, do you have $16,000? Do you have $20,000? Do you have $50,000 that you can willingly put on the table to the provider and then really hope that your sharing ministry gets those dollars not only back to you, hopefully they get them back to you, but what if it takes them 6 months to get back to you, right? And so I think again, we going back to Daniel's point is if you're playing with one engine and one pilot and no generator gets there, that's great. But what if it doesn't, right? And I think that's the hard part of healthcare sharing is when it goes bad, it has the potential to go really poorly, right? And again, cancer treatment. So who's got the cut? I mean, very few people in this country have the type of cash available to go negotiate prices for hundreds of treatments, right? And then have the financial resources to put that cash up before being reimbursed for. So again, going back to flexibility, amazing in certain situations, but then it can be pushed back. And I didn't even discuss that. I mean, that was before, we kind of move on to another topic is sharing ministries don't have regulations in terms of payment in terms of payment periods. And so a big thing that you'll see, again, really flexible because there have been hard times in sharing ministries where them delaying payment has allowed the ministry to survive, right? And that would be a good thing because we don't want to see sharing ministries fail. We don't. There are people's lives, their financial health at stake. And so their ability to delay payments over a period of time has allowed some of them to survive really difficult times. COVID is a great example of that. What that has created though is again, is they can decide we're going to pay these chunk of bills 90 days. We're going to pay them in 6 months. We're going to pay them in a year. We don't have enough money. We're only going to pay 35% of this bill, right? And so flexibility can be really nice and it can be a real, real problem for the membership.
And
But you get
I think,
that. Go ahead, Daniel.
good.
Well,
No, I was
saying
just
you
going to
get
say
that.
we could learn We can learn a lot. I mean, just what I'm hearing from Alex, like Alex has seen it from the health share side. And I think, I've worked in the insurance industry, and I think the insurance industry is trying to think of ways to emulate what the health sharing world has done in a positive sense. So I think there's so much to learn from, like, our system is broken in many ways. And some of these things we can, providers want to provide good care at efficient ways, and they don't want to like overcharge people if they can still make money and still do it in an efficient way. So I think, like, a lot of these principles can be taken by insurance carriers, and maybe just some of the downsides of, like, if providers have consistent payments within 30 days, or consistent like understanding of where the rules are in advance, so they're not left holding the bag. I think that you kind of have a taking the good from that, but like making it a little bit more structured is something that I think the insurance world is trying to move towards, which I think is great. And we should credit the health shares for like pushing the industry in that direction.
And we should credit the health shares with what Presidio is going to be, right? I think that's the beautiful thing of what, Daniel, you and Bob have created and had the vision to create is, why can't we take all of the good things that, because insurance does some really good things, right? It is really nice to have health insurance when someone in your family gets cancer, and so I mean, we're going to absolutely pull really good things from insurance, the security, the reserves, the stability, the projectability of our costs, all of those things. But then we're gonna bring in the great pieces that healthcare sharing offers, right? You don't have to sacrifice your biblical values, and there is not a single thing that's going to violate a piece of your faith, right? You don't have to compromise anything there. We are going to have flexibility with the doctors that you can go choose. They're going to come to my team, and we're going to serve them like a human being, right? Like Bob, like going back to what Acts 2 truly was, is maybe it wasn't sharing money, but it was prayers and treating people like a human being. And it's funny because in my healthcare journey, I've seen people. I feel like I've touched so many components of healthcare. And as we're trying to change how healthcare is delivered, there are so many technology solutions in healthcare. Everyone's trying to serve it and figure it out with a technology solution. But healthcare will always be personal. And I think that is the one thing I've seen with the thousands of patients I've navigated and walked through really large events. No matter how efficient or great your insurance or your healthcare sharing or all of those things are, at the end of the day, you are a human being going through quite possibly the most difficult thing you've ever walked through in your life. And there's just burden in your family. There's burden on you. There are so many things. And I couldn't be more excited to take all of our members and treat them like human beings and give them the security of what a health insurance company can do.
It's great. It's an unfortunate piece, because healthcare sharing ministries are not regulated. Have you have some healthcare sharing organizations that kind of ruin it for the rest of them. Like assuming that the healthcare sharing ministry does have a good relationship with providers and pays on time. Um, I think like from their perspective, like if I'm a healthcare sharing ministry, like I'm a lower cost option for people that need that align with the values, and like the trade-offs they have to be willing to make are that they have, there's caps on some of the benefits like maternity or certain incidents, or maybe you only have an annual cap on what's covered. And like those are all very clearly stated in the guidelines of what you're signing up for and should be. And so, I think I make that argument of like, you're getting a lower cost product, and, cheap doesn't always mean it's premium, right? And so you're getting a lower cost product that's more affordable, but you may have some exposure on the back end, but you're getting a more flexible program. Now, the piece of like, they don't have to guarantee payment is like, it's an interesting argument that like it's a critical argument, right? That like the insurance companies can make against healthcare sharing ministries, but because they're not regulated, like if they were guaranteed to make payment, then they'd be an insurance company. So like it's kind of like a supplement versus nutrition label, right? So like in the like FDA, if you're not an FDA approved ingredient or supplement, then you have to have a supplement label. So if you go to the grocery store and you're like, oh, here's a cool protein bar, you don't not most people don't not buy it because it doesn't have a nutrition label. Like they're okay with it being a supplement label. They just buy it and they eat it anyway. And so, I think people have to, be able to kind of make that decision for themselves. And it's kind of an unfortunate thing that the bad actors or those who haven't paid bills on times or have a history of that kind of ruin it for the rest of the sharing ministries. But I think that's one of the big trade-offs, right? Like as long as those guidelines are clear, you're getting a much more affordable product.
Which is another great point to just add on to that is there are some big, long surviving healthcare sharing ministries out there that have been around for a while. They'll say they've paid all maybe eligible bills, or they who determines what is eligible, or those types of things. That's a different conversation. But then there are a ton of really small ones, right? I mean, you can do a quick Google search on some of the big ones. There's a big one out there that just has a lot of really bad press about it, and some money that was not really used for medical bills. It was maybe kicked to some outside things for the people running it. And then you've got a ton of really small ones, right, that just they're kind of in the wilderness figuring it out, and they may not have the expertise, but Cameron, that's a great point. But there are a handful of really large established ones that have served people in amazing ways, right? They've paid billions of dollars in medical bills. They have, served people in really difficult times. And maybe there were some struggles in that process, but they still did, in essence, kind of what they wanted to do. So I think it's just important, like you said, for the consumer is it established? Is it large enough to handle large medical bills? Is it have maybe the professionals like an actuary or a consulting firm doing those types of things? Those are all questions you have to ask, and then you have to make an educated decision for you and your family.
That's good. Bob, you have some insights here on the Alex brought up the maternity piece, and I think just kind of like double clicking on that, like some of the pro-life pieces and the operating principles, right, of like these healthcare sharing organizations. Like you've got some points there to like bring up some like good and bad on the HCSN.
Absolutely. Yeah. And I think it all comes back to, again, the question of regulation. Is it in a regulated environment or is it not in a regulated environment? And I would just, the question of whether the regulation is good or bad, it's not a black and white issue, right? Like there's some places where regulation is good. There's some places where it's overstepping. And the lens through which I would analyze that question is the principle of subsidiarity, which says that issues should be addressed and solved at the lowest level that they can effectively be solved at. And when you apply that into the healthcare landscape, the answer and outcome is a little bit complicated. And it kind of depends because we have all sorts of interactions and touch points with the healthcare industry, right? And I'll highlight two places where I think having these healthcare sharing ministries in the non-regulated space is actually a win, a net win for our economy right now. And the first place is relatively low dollar amount healthcare interactions or healthcare services, right? And I'm going to define this as it. I mean, it can be different for different families, but I would think of it essentially as like, at what level is the risk of not having a healthcare bill paid going to be financially damaging to a family? Would the family be at risk of bankruptcy, right? And let's just call it $50,000 for the American family. It's not a small amount. I'm not saying it's a small amount, but if push comes to shove and if you had a $50,000 bill on your table that had to get paid, a lot of American families, I'd say average American family, could probably figure out a way to get it paid without risking, bankruptcy. So I think healthcare sharing ministries do a great job of serving those individuals with relatively predictable, low cost, like ER visits, annual wellness visits, stuff like that. And I think there's two key components to this. It's risk of something going wrong. And we just talked about, like, there's relatively, especially if you join a larger healthcare sharing ministry organization, the risk of something going wrong and them not being able to pay is very low, right? It might be 1%. There's not the regulatory guarantee of payment. So it's small, but it's there. And then the second thing is the risk of, if something goes wrong, what's the potential magnitude of exposure, right? And I think a lot of times we don't think about that second question. We only think about the first question. We're like 1%, probably not going to happen to me. I'm good to go. Right. But and I just this is an analogy I'll throw out there. Might be silly, but I got my 5-year-old son jumping on the bed, right? Risk of something going wrong there, relatively low. Maybe it's 1%. My 5-year-old son's not particularly coordinated, so maybe higher than 1%, but we'll say 1%. If something goes wrong, what's the magnitude of exposure? Okay. Most likely outcome is he bumps his head, he cries for a little bit, he needs a pack of ice. Maybe he breaks a leg and needs to go to the ER. I would consider that relatively low magnitude of exposure. Contrast that to a 1% chance of your parachute failing when you're jumping out of an airplane. The risk of something going wrong is the same, 1% chance of something going wrong. But if that goes wrong, it's a huge magnitude of exposure. You're going to die. And I think that comes back to, like, jumping out of an airplane is like, sometimes when we're interacting with the healthcare space, we have huge medical bills. There's a slight chance that you're going to be exposed to a huge medical bill somewhere along your lifetime. It's small, and the chance of your program not being able to pay for that is small. The magnitude of exposure could be significant. So that's, to bringing this back, where there's a low magnitude of exposure for these relatively low dollar amounts interactions with the healthcare space. I think healthcare sharing is a great tool. The problem is, the way that our system is currently set up, I don't think there's not a great way, or there aren't many options for families to limit their healthcare sharing exposure to only those small dollar amount claims, and then have access to something that's appropriate for the higher, in excess of $50,000 claims. So that's one place where I think healthcare sharing serving it's really important to have healthcare sharing in this unregulated space, because it doesn't add unnecessary costs, and it's something that's appropriate, these low dollar interactions. The second place where I think it's really great to have these unregulated spaces is where regulators go wrong, where they're corrupted, or they just over-regulate the space, right? And this is particularly acute to American Christians right now, because we are living in a healthcare industry that's defined by the Affordable Care Act, or Obamacare, which has a contraceptive mandate that majority of Christians are fundamentally opposed to, whether they're opposed to contraceptives, the whole range of contraceptive services, or if they're just opposed to the abortifacient side of contraceptive services. And this is where, in my opinion, regulators have gone way too far with this. Okay. They're jeopardizing people's religious beliefs. And we know, those who are listening to this podcast will probably be familiar with the Hobby Lobby case that went to the Supreme Court, that sued and said, you guys are infringing on our religious rights. And they got some protections, they're narrow protections. But even before any of that happened, it was important to have these healthcare sharing ministries completely untouched by the Affordable Care Act, that can pop up products immediately that were consistent with Christians' values, that serve the purpose of continuing to pay for people's medical bills in a way that's consistent with their religious beliefs and values, and doesn't force them to pay for stuff that the regulators wanted us to pay for, but that violated our fundamental religious beliefs. So it's really important. I think they serve a great role there. Now we're seeing that as time goes on, after the Affordable Care Act has been implemented, more people are challenging it. It's continued to be regulated or litigated rather. And we're starting to see that the limitations peel back a little bit. And we're excited to bring the first product that's actually fully insured and fully consistent with religious beliefs, that will never pay for abortifacients or contraceptive services. So, but in that sort of bridge that gap, the healthcare sharing ministries in the non-regulated space have been really pivotal. Now, there are a couple of shortfalls you could see in that analysis of, like, where it is actually really important that this industry is regulated and subject to regulation. And this, bringing it back to like the maternity piece, Cameron, that you mentioned, the catastrophic claims, right? The insurance industry has been set up specifically to protect against that 1% chance that something catastrophic goes wrong. That's why American families use and need insurance, is to protect against that, and to guarantee that all of those bills get paid. And I'll just highlight two mechanisms that are inherent in the insurance industry that protect against that. One is access to what's called reinsurance contracts, and the second is regulatory oversight and guarantees. Okay, so we'll take each one of those in turn. Number one, reinsurance contracts. So just to do a quick explainer one-on-one on what this is. Imagine your family is on an insurance plan and there's a $5,000 deductible, and you have $1 million claim. Say it's a NICU baby. You pay $5,000 and then your insurance pays the rest of it, right? Up to $1 million. What you don't see on the back end is your insurance pays $1 million claim, and then they probably have access to a reinsurance contract. And it's exactly like your contract. It's just their deductible is much, much higher, say $300,000. So your insurance company gets reimbursed for the balance there, $700,000. So that their exposure is limited to that $300,000 claim. That's important because any industry, anybody that's in the business of flattening out risk wants to flatten out their own risks. The way the insurance companies do it is access to reinsurance contracts. The way the healthcare sharing ministry plans do it is just by putting limits in place. So, Cameron, you mentioned the NICU baby. A lot of these all the healthcare sharing ministry plans that I'm aware of have annual and lifetime limits. Some of them have specific limits for stuff like prenatal care or labor and delivery charges. It might be like $100,000. That, again, it's okay most of the time. Average pregnancy, labor and delivery cost, but you'd know better than I would, but what, $10,000 to $20,000, maybe $30,000, and that would, I think, include by cesarean section.
Yep.
But NICU, you could be looking at a $500,000, $2 million claim. Okay, so it's very important that like $100,000 limit on that policy actually could be a big deal if you wind up having a NICU baby. Reinsurance is one of the ways that the insurance industry addresses that guarantee. The second is actual regulatory oversight and guarantees of payment. Again, not saying regulation is good or bad per se, but it's a facts and circumstances analysis. But in this situation, I think it is important that we have some consumer protections. Somebody looking over the shoulder of the insurance company and saying, do you have sufficient capital to pay your claims that are coming in? Or are you just trying to get by and maximize profits and put out a cheap product to sell and to have more volume, right? Because that could put your consumers at a very financially risky space. So that's the number one step, is that financial oversight, making sure that experts are in the background, double checking all of your work and ensuring that you've got adequate capital. And then the second piece that kind of goes hand in glove with that oversight is actual regulatory guarantees. So every state, just a quick overview of the regulatory framework we're talking about. Affordable Care Act is at the federal level, and it sort of sets the bar, the minimum for what every insurance product has to offer. And then every state has their own Department of Insurance that regulates insurers in that state. And every state has a guarantee fund so that if you are, as an insurance company, selling insurance products to residents of that state, the state will guarantee payment of their medical bills if you, as the insurance company, declare bankruptcy or something goes wrong. That's extremely important for families, especially those facing high medical bills. So these, again, just bringing it back to the analogy, these are the guarantees and safeguards that we have in place to protect against that 1% chance that the parachute fails, something goes catastrophically wrong. Even in the insurance industry, we've got guarantees to protect against all of that. Whereas if you're in an unregulated industry, you kind of just have to be aware of those risks and either willing to take them or have a backup plan to sort of protect yourself in place.
Yeah, and I want to just want to speak to just one real quick on that pro-life piece, because I know, Bob and I, founded this company, and really, just to say one thing on that, like, we as Christians, it is imperative for us to build these organizations to preserve those religious liberties, whether it's in the insurance or the health share space. Like, this is something that's very vital. And I think we've been behind in doing this. It's kind of taken some time, but we saw it through COVID. You can see how, like, the medical field is very, very important to have influence over as Christians, to make sure that, like, our values aren't getting pushed out and we're not being controlled by governments or insurance companies who don't respect our values and beliefs. So, like, go back to what Bob said, as these health shares, it's vital to have that unregulated piece that preserves that liberties. I think it's also vital to have the regulated piece. And this is something, like, all of us should be working towards to make sure that's the case. So,
Yep. Yeah, I think it's good, but like a good point. It just like backing up to the 1%, like, catastrophic risk. You've got and I always want to, like, caveat, like, the well-run health shares. I've represented some of them in past life from like kind of a sales perspective, helping folks get signed up for them if it's a good fit for them. The ones that are well run, like they have these caps in place, from my understanding, right? Because if they didn't have a cap on maternity, they would be just a birthing baby program, right? And so that's like one of the concerns maybe they have. Or if they didn't have a cap on, certain procedures, in certain benefits, you have folks who maybe like Jerry knows he's got a bad hip. He's had a bad hip for a decade, but he's never had it treated. So it's never going to show up as a pre-existing exclusion. He's going to slide through. Now, I guess technically he lied about it, but like, is going to slide through depending on how the guidelines are written. Like, you now have a hip replacement. And so, you've got this structure in place to prevent, folks from coming on knowing that they need, you're trying to make sure that you have really healthy people on these health shares, right? But I think one of the things that is interesting that they do, they all have different names for it. I call it kind of like an internal like GoFundMe, but when you make your monthly share payment or premium payment, like you can also pay extra, or you can round up to pay extra every month or on a one-off basis to basically a bucket of funds that pays for these types of things. And a lot of these sharing ministries have like a pretty good track record of paying for the $1 million NICU baby when that did happen, even though, even now it's kind of a funky process, right? Like it's got to go through this like separate committee that reviews it and decides like put those funds towards it. But a lot of them will kind of celebrate the fact that like, they've always paid, those bills, even though they're not technically eligible for sharing out of this like, extra bucket of funds. And so I don't want to use like the actual names because I don't want to, call out any sort of ministry, but like I would say too, like they're not regulated, so they can't have an official program for that, but like they're doing everything in their means, like in a unregulated non-insurance way to, make sure those bills are paid. So like there is some like beauty in that too that I think is interesting if it aligns with someone.
But it's kind of ironic too, right? Like Bob, I wanted to kind of expand on one quick thing that you said about the 1%, right? So I call it the insured but uninsured population that we're seeing now. So deductibles, out of pocket maximum. When you go to the ACA, it's unbelievable, right? You sit there and you look at how much you're paying and you go, wait, what? Like I still have, after the $1,500, I still have, $7,500 per person, $15,000 like household out of pocket max. Like what is going on? And I think when you're looking at that 1% as a consumer, healthcare sharing's become more expensive over the years, right? They're trying to play catch up in terms of medical spend. And so you have a $10,000 out of pocket, and then you pay or a $10,000 deductible, or whatever that healthcare sharing entity calls it, and then you go $600, $700, $500 a month. Basically, only have catastrophic coverage, right? So you're at 6, 7, 8 grand in premiums or shares, plus another 10,000. And then a lot of the healthcare sharings don't include any sort of preventative care, right? So that's no office visits, that's no mammograms, that's no female visits, kids type stuff. And so it's kind of ironic, Bob, that most people are, they really want healthcare sharing or they want insurance for that catastrophic event. But in order to meet your deductible and your out of pockets and your premiums, you really have to have a catastrophic event to even use it, right? And, in Presidio, one of the things that I just couldn't be more happy about what we're going to be able to offer people is value from day one, right? So no deductibles, no co-payments, and we're gonna basically be in there with you at $1, right? So you're going to have an out-of-pocket maximum that you'll get to, but we're going to be paying part of those bills from you from day one. Whereas if you're in a $10,000 out-of-pocket for healthcare sharing, you're going to be $15,000, $20,000 deep before you get any value, and you're basically at a catastrophic event. So you should have insurance because you're basically using healthcare sharing for the one thing that they're not maybe the best at. those really large catastrophic bills. And
Yeah,
so,
it's like there's this narrow corridor, right? Where it's like you
yeah,
have to reach this threshold, but then once it exceeds this threshold, you're on your own.
yep,
And we're saying, no. It's from $1. We're gonna go halvesies with you on everything up to this amount, and then we cover everything in
after that.
excess of that,
Yeah.
which is, the idea there is hopefully it's, going back to your point of serving the person. Hopefully it's this, we're just trying to apply common sense to, I think, an industry that's been like
Severely
overly
lacking.
complicated, unnecessarily. Common sense is severely lacking, maybe. And people have just taken their eye off the ball, which is, hey, how can we serve people?
I think we get to take, and we say this all the time, right? But some of the beautiful things of like healthcare sharing, right? And like that they do that are creative, right? But actually put it into like an insurance type model that has a framework for its function. And I think it's pretty cool what we're doing here, and excited to bring it to market. But just some like kind of parting advice for individuals and families out there that are looking at healthcare sharing programs. I think we each probably just have like a little tidbit here to just kind of give you some advice on like what to look out for or what to consider in weighing your options. I think for me, like the number one thing is this you have to find there are some very reputable healthcare sharing ministries out there, and there are a lot of really small ones that are either just getting started or don't have a high level of membership. That doesn't always mean it's a bad thing. Some of them don't have a lot of membership, but they're really well run. So you really need to do your homework. But I think for the most part, aligning kind of your health and your wealth, with the longevity and the success of the healthcare sharing ministry that you're looking into, right? So if you're trying to start a family or you don't have a lot of disposable income, you're going to want to make sure that you're looking at healthcare sharing options that are, if that's the choice you want to make, right, that are uh, you know are going to have more of a history of paying claims, have a larger pool of membership. You're going to want to look at your kind of big three large ones out there. If you're someone that's got a lot of disposable income, you could essentially self fund your own insurance anyway. And you kind of like some of these nuanced communities of, there's a health share out there that's focused on carnivores, people that like to just eat meat. Like maybe that's like something you're really interested in, but they're smaller. Just if you're really healthy, you never go to the doctor, you're not really too worried about a big claim coming up, maybe that's something you should look into. You would be better fit for that. But I think just, being wise about aligning kind of your health and your wealth and the track record of that healthcare sharing ministry to kind of get to the one that's, the best fit for you would be my advice. How about you guys?
Yeah, I'll kick it off of like I'm the actuary, so like I'm super risk averse, and that's like just to like everyone's gonna have different risk levels. So knowing that like you're talking to a person that doesn't like risk, and I'm a dad, and when I think about just like the health shares, I personally, and friends come up to me and they ask me these questions. So this is what I tell them, tell my friends, family who are thinking about it, is I would absolutely go back to what Alex said in terms of history of have they had the history of paying claims, these ones that have been larger for longer. Those are the ones that I would look at. Like it goes back to like you don't know if they have a pilot or an engine. That's true. You can't like guarantee it, but you've actually seen their flight log long enough that like okay, they have history of like getting you where you need to go, right?
They're landing the plane a lot of the time.
Yeah, they're landing the plane. I mean, for the most part. So I think I would definitely steer away from like the small ones. I would go towards the large ones that have been around for a while for sure. And then I would just be on it. Like, don't buy into some of the like stuff that they say. Like, you should be. It may sound nice, but like when people are trying to sell you that like we don't have a network and we don't do this or blah blah blah. Like, just like approach it from a realistic standpoint and just say, okay, like I'm joining a healthier risk pool. That's why it's cheaper. It's not magic. This is just math. And be prepared to like face reality at times if you like the doctor may not accept it because it's healthcare. They may accept it. So like just know what you're getting into and know that like all of the kind of the rosier picture of it is probably not the case in some scenarios and just be prepared for that.
Yeah, and that's a good one for me to bounce off of because my couple of things are more on the tactical in the middle of a case type thing for you. nationwide networks. You can go anywhere you want to go. The reality is, if you're watching, if you made it to this point with us, there are a lot of hospital systems and a lot of doctors that do not take healthcare sharing, period. You can't go in the door. And the reason for that is they do not guarantee payment. The hospitals are looking at it and say, listen, if we deliver this baby and all goes good, it's completely fine. But if that baby goes into the NICU, we now have taken on a liability to the hospital that we just don't want to take. And you can go anywhere you want to go, nationwide networks, yacht, all of those things. Highly skeptical that that's really the case. The other side of it is on the charges, right? Look, are there creative outs? If you see things like excessive charges, we pay percent to Medicare, those types of things where there's no limit or there's no maximum, or you can sign up for this amount, but we will only pay it if it's none of those things. Real big red flags there. Yeah, just that's the tactical stuff that, again, it's not a big deal till you're bankrupt, right? It's not a big deal till they tell you your $80,000 hip replacement is too expensive, and you went to the doctor and that the healthcare sharing ministry said you could go to, right? They're like, we're only paying 40 of it. Okay, well, why? Because it was an excessive charge. Those would be my couple big ones.
I'll just add 3 quick points here. Number 1, look at their claim limits. Be aware of what their claim limits are, and are you comfortable putting your family with that level of risk? I'm not saying it's wrong and you shouldn't be comfortable putting your family in that level of risk, but you need to be aware of it before you sign up for the program. Number 2, just do a quick diligence check. Look at healthcare sharing reviews, look at their Facebook page, see what their members are saying. A big red flag that I would have, and I would never put my family on a product, is if their members are all saying that there's significant claim lags, they're not paying my bills, or their bills are delayed in payment. There's a reason for that. It's a way of covering up financial mismanagement, and they may not have money to pay bills in the future. Huge red flag. And then the third thing that I would say that's tangential to this conversation is, I think Christians should have the freedom, and I want to give you the freedom to make an informed decision for yourself. My family, I decided that healthcare sharing ministry is not appropriate for my family and my risk tolerance. I think it's a facts and circumstances discernment for every Christian family. There's not great options out there right now for Christians, which is why we're building Presidio. But to have if you think that your family needs to be on an insurance product for whatever reason, and the only options that are available to you right now are some that cover services that are against your morals, it's just a tough decision to make. But it's not directly, I would argue, it's not, from a theological perspective, not direct. You're not morally, you're not participating in the moral evil of abortion or contraception. It's incidental, and you just have to make a decision between one not great option and another not great option.
And if you have questions and you're watching this and you want to if you have any concerns, or even my role with Presidio is going to be on the bill side. If you have bills, if you're part of a healthcare sharing ministry and you are trying to figure out a path on your bills, or you have a large bill, or something's been denied, or it's not getting paid, shoot it to us in the comments. Get a hold of us. We want to serve everybody, believers, non-believers. We want to do it in a biblical way and treat you like a human being. And if you're just stuck, or you want more questions, or trying to get some answers, let us know in the comments, or get a hold of us. We'd be happy to reach back out and guide you in our best way.
Yeah, it's great, guys. We like analogies here, so I'll just leave you with one more. When it comes to healthcare sharing, there's a lot of comparison, to the Amish community, right? And so, you've got these Amish communities where this is what they do day in and day out. Like, they share in each other's burdens, they take care of each other, healthcare or not, right? And so, if you're moving into a new Amish community, you're gonna find your people. Like, you want to find the group of people that are going to show up for your barn raising event, right? You want to find the Millers and the Yoders in the community that are like, that have a proven track record of helping you build your barn in one weekend and getting it done. And I think that's like the analogy you want to look at when you look at healthcare sharing, right? Like, you want to find the community of Christians that are paying into this, pool of funds that pay bills regularly, and you're not going to be left out to dry. And so, that's something to like kind of think through, is like, you know, if you were Amish and you had to join a community, you're going to pick the one that's going to like best take care of your family in the times of hardship. You're not going to pick the one that just doesn't show up and kind of pretends to be Amish. Um, and you know, that's not going to be the approach. You know, that's what I want to kind of like leave you with. But yeah, appreciate you guys joining, listening in to our uh, you know, our discussion here around healthcare sharing, and hopefully you learned something. Like Alex said, if you have any questions, drop them in the comments, and we look forward to being with you on future shows. Thanks.